The AON Lab was started in 2018 at the formation of the company itself. The laboratory is the heart and soul of the diagnosis. The vision of the AON Pathology Lab is to internalize the laboratory to support directly the AON company, the clinics, and ultimately our patients.
Our process begins when our samples get delivered. Our accessioning department will begin unboxing those samples. They will check the temperatures, check for any IATA violations that may have occurred. So that's really imperative for our clinics to follow our standard operating procedures as far as it relates to packaging and shipping, because the quality of our results is directly impacted by the quality of our samples. Once our bone marrow samples are processed and all of our pathology, those are sent off to their respective departments for testing. Each bone marrow receives comprehensive analysis and then additional testing as added on by our pathologist as needed. Once all testing is completed in any department, whether that's clinical or pathology, those results are immediately available in the EMR chart for the physicians to view.
By having everything in-house all under AON's umbrella, this leads to several advantages. First off, our turnaround times are actually superior when you compare it to the industry norms, which leads to a faster and quicker diagnosis, which leads to earlier times to get patients on treatment, and helps reduce anxiety that patients as well as their family members and caregivers have. As a physician, I find this tremendously gratifying.
Anytime we can develop a test or improve our operations to increase patient outcomes is always a win for us. We're always trying to optimize operations here at the Central Lab, as well as optimize operations for the clinic side labs as well. But one of our most forward-facing projects right now is we're actually assessing different partners for NGS testing to bring to our network and our patients.
Centralizing NGS testing in-house allows us to build that contract with our payers, offers faster turnaround times, and improves patient care. AON Lab has accounts with reference labs, such as LabCorp, NeoGenomics, Quest, and GenPath, and if we are unable to process the sample in-house, then we have those accounts in place so that way we could forward that order and the specimen to the reference lab. Most of our reference labs are interfaced with our EMR. Therefore, once the report is released, the physicians and the patients have access to that record as well.
From improved quality of reports, increased communication, and the financial benefit, the physician-owned lab is a unique benefit to the clinical practice that you're not going to find in any other setting.